You know that quiet moment in the early evening when you sit down after a simple walk around the block and your heart feels like it's working just a little harder than it used to? Or you notice your ankles swelling by the time dinner is on the table? It's not a crisis. It's the kind of thing you've come to accept as part of turning 60 or 70 or 80. But what if some of what you're feeling isn't just normal aging? What if one of the everyday pills sitting in your medicine cabinet is quietly making it harder for your heart to keep up with the life you still want to live? I'm Dr. Robert Miller. For 35 years, I sat across from seniors just like you in my office, listening to the frustrations that 15-minute appointments never had time to address. I've watched how common medications, prescribed with the best intentions, can have hidden effects on the heart that no one mentions because the system simply doesn't leave room for the conversation. After 60, your kidneys filter more slowly, your liver processes drugs at a different pace, and when several pills are taken together, the interactions can add up in ways a quick visit rarely catches. In this video, I'm walking you through 5 common medications millions of people over 60 take every single day. We'll count them down from the least to the most powerful in terms of their potential hidden impact on your heart. I've gone through the real studies, so you don't have to. You may be wondering which medication is most affecting the energy production inside your heart muscle cells. That's something we'll uncover together. Or how a pill you take for another condition could be quietly linked to changes in your artery walls over time. And whether protecting against these hidden effects can help you keep the independence you've worked so hard for, so you're not a burden on the people you love. The most powerful one on this list is taken by roughly 1 in 3 seniors, and what the research shows about safeguarding your heart while taking it is something that could change how you feel every single day. If this sounds like what you or someone you love is living with right now, tell me in the comments which of these medications you take. I read every single one personally. This video will take about 25 minutes, and the most practical, hopeful information comes in the second half. Stay with me. You deserve to hear the whole story. Let's begin with the first one on our countdown. You wake up in the middle of the night with a leg cramp that pulls you out of bed, or you feel your heart skip every so often when you're sitting quietly watching the evening news. That's the moment many of my patients first mentioned to me when they were taking water pills for blood pressure or fluid retention. These water pills are incredibly common after 60 because they help control pressure and swelling, but they can quietly pull magnesium out of your system in ways that affect the very rhythm of your heart. A 1987 study, published in the Archives of Internal Medicine, looked at older patients, around 81 years old, who were taking these water pills. Those patients had much lower magnesium levels in their blood than patients not taking the medication. That lower magnesium was linked to the kind of muscle cramps and irregular heartbeats my patients described. You've probably felt that same unexpected fatigue or fluttering in your chest after a long day, and been told it's just age. It's real, and it's not imaginary. Magnesium is like the quiet traffic cop inside your heart cells, keeping the electrical signals smooth so the muscle relaxes and contracts at the right times. When levels drop, those signals can get a little jittery. The most common mistake I saw was assuming that because the blood pressure number looked good on the monitor, everything else was fine. No one was checking the magnesium. The simple fix is magnesium glycinate, 300 to 400 milligrams taken with dinner. It's gentle on the stomach and absorbs well. Many of my patients noticed fewer cramps within 2 to 3 weeks and a steadier heartbeat by the 1-month mark. You'll feel it as less of that heavy-legged tiredness at the end of the day and more steady energy when you move around the house. If you're still watching, you probably found this video because you searched for answers about the medications you take every day. You may not know this channel exists, but every week I send out new health information made specifically for people our age. Press the subscribe button just below this video. It's the easiest way to make sure this kind of practical guidance keeps coming to you. Without it, you might miss the next piece that could protect the independence you value so much. You've already come this far with the first medication on our list, and you're learning things most appointments never cover. Here's something surprising most seniors never hear. Even a mild magnesium shortfall can make your heart work harder than it needs to, yet the fix is often as simple as one well-absorbed mineral. But there's an even more unexpected detail coming in the next point that changes how we think about a medication millions take for blood sugar. You've stayed with me through the first 2 medications, and that tells me you're serious about protecting your health. You're not just watching. You're doing something meaningful for the years ahead. So far, we've talked about water pills and their effect on magnesium, and the diabetes pill and its impact on B12. In light of everything we've covered, that simple blood test I mentioned earlier, the one your doctor may not routinely order, now makes perfect sense. Checking your magnesium and B12 levels together can reveal exactly what your medications are quietly taking away. The most exciting finding still ahead is the one supplement that, when added correctly, gave one of my patients back the strength to walk to the mailbox without stopping. You deserve to hear the rest. Keep watching, you've earned it. And while you're here, press the like button. It simply saves the video so you can find these steps again easily when you need them. You probably found this video through search and may not know this channel exists. You'll receive new health information made for people our age every week if you press the subscribe button just below this video. Subscribing is the only way to be sure you don't miss the next video that could protect the daily independence you're fighting to keep. Without it, that information might never reach you. After the third medication on our list, you've already received so much practical information. You've learned how 3 everyday pills can quietly affect your heart, and you've seen real ways to push back. Here's something surprising that most seniors never hear. Even low-dose steroid pills taken for months can quietly raise your heart risk in ways that feel like normal tiredness. But there's an unexpected detail coming in the fourth point that involves a medication many of us take without a second thought. You've watched this far, and that tells me you truly care about your health. I'm leaning in here because I want to ask you something personal. Which of these medications feels most relevant to your own daily routine right now? Tell me in the comments. I read every single one myself. You've already proven you care about your health by watching this far. The next natural step is to press subscribe, so these conversations keep coming straight to you. It's a quiet commitment to the independence you deserve. The fourth medication on our countdown is one that many seniors take for joint pain or swelling, and the research on protecting your heart while using it is something the mainstream conversation often skips. Long-term low-dose steroid pills, even at small amounts, have been shown in a 2020 study published in PLOS Medicine to raise the risk of heart problems in people with ongoing inflammation conditions. The study followed thousands of adults over 50 and found the risk grew over months and years. You've probably felt that extra fatigue or noticed your blood pressure creeping up and been told it's just part of managing your condition. It's real. These steroid pills can quietly promote swelling in the blood vessels and affect how your body handles fluids. The fix that worked for many of my patients is adding 2 to 3 grams of omega-3 fish oil daily from a high-quality source. A large review in the journal Nutrients showed measurable improvements in blood vessel health and lower inflammation in older adults. You take it with breakfast so it absorbs with food. Most people notice steadier energy and less swelling within 4 to 6 weeks. The biggest mistake is stopping the steroid abruptly instead of working with your doctor on a slow taper while adding the omega-3 support. You've stayed with me through 4 of the 5 medications, and the most powerful one is still ahead. Here's a surprising medical fact most seniors never hear. Even when your blood work looks normal, the combination of these medications can still be draining the very nutrients your heart needs to keep its rhythm steady. But there's one unexpected detail coming in the final point that changes how we think about the most commonly prescribed heart medication of all. You've already proven you care about your health by watching this far. The next natural step is simply to press subscribe. It's a personal request from me to you, nothing more. The most powerful medication on our countdown, the one taken by roughly 1 in 3 Americans over 65, is a statin for cholesterol. I prescribed them for years because they save lives in people with established heart disease, but the hidden cost is something the guidelines still don't emphasize enough for everyday seniors. Statins can lower coenzyme Q10 levels, the very molecule your heart cells use to produce energy. A well-known study confirmed a 30 to 50% drop in CoQ10 in older adults on statins, and that depletion shows up as the deep fatigue and muscle weakness so many of my patients described. CoQ10 is like the spark plug in the engine of your heart cells. Without enough of it, the engine runs rough. The most common mistake is thinking the tiredness is just age or the statin working. The practical step is 100 to 200 milligrams of CoQ10 daily, taken with a meal that contains a little fat. Many patients felt a noticeable lift in daily energy within 4 to 8 weeks. You'll know it's working when the afternoon slump fades and you have the strength to keep doing the things you love. Here's the simple daily plan I gave to patients in my office when we sat down together for that longer conversation. In the morning, take your omega-3 with breakfast and your B12 under the tongue with your first cup of coffee. At dinner, take the magnesium with food and the CoQ10 with whatever meal has a little fat. For anyone on low-dose steroid pills, we added the same omega-3 at breakfast. In the first 2 weeks, you may notice steadier energy and fewer nighttime cramps. By the end of the first month, most people tell me the afternoon fatigue has lifted and their heart feels less like it's working overtime. One important warning: if you're on blood thinners or blood pressure medications, let your doctor know before starting magnesium or omega-3 so they can check levels and adjust doses if needed. Never stop any prescribed medication on your own. Bring this list to your next appointment and ask for the targeted blood work. 1 month from now, you'll likely feel the kind of steady strength that lets you keep doing the things that matter most to you. Walking to the mailbox, playing with grandchildren, or simply enjoying your own home without that constant heavy tiredness. I still remember the day a 72-year-old patient sat in my office and quietly said, "Doc, I just want to feel like myself again so I'm not a burden." That moment changed how I practiced. I've seen the frustration you live with, the way doctors dismiss the tiredness, the cramps, the swelling as normal for your age. Those struggles are real, and they are not imaginary. You deserve answers that actually help. Here's the truth that stays with me after 35 years. When we finally address what the medications are quietly taking away, the body can still respond with more strength than we give it credit for. You are not powerless, and you are not a burden. You are someone who has earned the right to protect the life you've built. That deeper question I mentioned earlier about how addressing these hidden effects could help you stay independent. Everything we've covered today connects directly back to that fear we all share of losing control of our own days. By having the conversation with your doctor and adding these targeted supports, you're giving your heart exactly what it needs to keep beating strongly for the years ahead. Tonight, before you go to bed, write down the 3 questions you want to ask at your next appointment. It's a small step, but it's yours, and it matters. We've walked through 5 common medications: water pills, the diabetes pill, steroid pills, and the 2 others that quietly affect magnesium, B12, and energy production inside your heart cells. You now have simple, practical steps that can make a real difference in how you feel every day. Which one of these medications or symptoms feels most familiar to your own life right now? Tell me in the comments. I read every one personally. If you want the next video that reveals the single most overlooked lab test that can protect your heart in the years ahead, press subscribe right now. It is free, and it's how YouTube sends it straight to you. You'll learn one surprising detail about a mineral most doctors still overlook. This information is for educational purposes only, and is not a substitute for personalized medical advice. Always speak with your physician before making any changes to your medications or adding supplements. Take care of your heart. It's been working for you every single day. You deserve to take care of it right back.